Good morning. Welcome to Salina Regional's Morning Medical. Today's program we're going to be talking about diabetes, which is a disease that affects an estimated 1 in 10 Americans. With me I have Carly Cozet. Carly is a pharmacist with Salina Regional Health Center. Like I mentioned, diabetes, I know, as well as treatments that Salina Regional does, we also offer some other programs for diabetes.
So we've had for several years the diabetes classes that they offer 4 times a year, and that's a series of classes that is taught with pharmacists and dietitians and diabetes educators. But this past year we actually had the opportunity to start a diabetes support group for the community, and it's a free support group setting where we have different guest speakers each time, and we offer door prizes and we have drawings each class and give people the opportunity to ask questions about diabetes in a friendly, kind of an informal environment. So we've done that. We had 8 sessions this past year.
You mentioned about some of the questions. Let's kind of hear, you've heard some of the questions that you've gotten. What are the most common?
Well, since it's pharmacist driven right now, we have usually at least 3 pharmacists at every meeting, so we get quite a few questions about medications and side effects, and some side effects from medications are pretty easy to deal with, and we can talk about that at each meeting. One of the biggest things that we've gotten questions about is diet, though, so we try to incorporate recipes, and we've had the dietitians from the hospital come and talk at each of our one of our classes to give ideas for healthy eating for diabetics and their families and how they can still keep a semi-normal diet but be friendly to their diabetes. So that's something that we've really worked into each class.
Is that probably the most important thing for the diabetic patient, is their diet?
I think it's one of the big parts that's maybe one of the scariest parts for someone
Right.
diagnosed with diabetes, and it's a part that definitely has a lot of misconceptions. They're told that they absolutely can't eat certain foods, so we try to clear that up and make sure that they have ideas of what they can eat and things that are healthier.
And I think this program is funded through the Salina Regional Health Foundation,
Yes,
correct?
we got a really gracious grant from the foundation that has allowed us to give door prizes out at each event, and we gave out a grand prize, which was we gave 3 gift certificates to Dillon's to help buy some of the ingredients for the recipes that we gave out, and that was our grand prize for any member that attended 4 events this past year.
Okay. For somebody who might be interested in looking at some of these courses, how's the best way to find out about them?
Once we have selected dates for this upcoming year, they will be posted on the community calendar on Salina Regional's website, and that information will be on there.
Thank you for watching. For more information, please visit srhc.com, like us on Facebook, and follow us on Twitter.